Bismillahirrahmanirrahim. Calcium and phosphate regulation in the extracellular fluid and plasma is discussed in this video. The calcium regulation is precisely regulated, and the normal concentration of this calcium in extracellular fluid is 9.4 milligram per deciliter. And This level is tightly controlled, varying only slightly because calcium is vital for many of the functions, and there is only few percent change in this concentration, and it amounts about 2.4 millimole per liter. When the concentration is increased for more than this, it is termed as hypercalcemia, and when it is decreased, it is termed as hypocalcemia. So the vital functions that are dependent on calcium are muscle contraction of the cardiac, smooth, and skeletal muscle, blood clotting, and transmission of the nerve impulses. So excitable cells like neurons are very sensitive to calcium level. If there is hypercalcemia or high calcium, it depresses the nervous system, while low calcium level or hypocalcemia excites the nervous system. Only 0.1% of the total calcium is present in extracellular fluid, while 1% is present within the cell. However, this around 99% or 98.9% of the calcium provides structural support in the form of the bone and remains there as a reservoir. Uh, the phosphate is also uh, an important one, and it is less tightly regulated than calcium. The body phosphate distribution is around 85% present in the bone as reservoir, uh, in the form of hydroxyapatite, while 14 to 15% is present intracellularly, and less than 1% or 0.1% is present in the extracellular fluid. Phosphate still it plays essential roles such as energy metabolism and various cellular function, and the various regulatory mechanism for the phosphate are same factors as for the calcium. Calcium in the blood plasma exists in three main forms. Number one, the protein bound calcium, that is around 41% of the plasma calcium level, and it is around 1 millimole per liter of the plasma calcium. It is bound to plasma protein like albumin, and this form cannot pass through the capillary membrane, so it is non-diffusible. This bound form is non-diffusible. Then the calcium is complex with various anions, that is around 9% of the plasma calcium, that is about 0.2 millimole per liter, and is bound to anionic substances like citrate and phosphate. It can diffuse through capillary membrane, but it is not ionized, so it is not active. Then another form is ionized free calcium, that is around 50% of the plasma calcium, and it is around 1.2 millimole per liter or 2.4 milliequivalent per liter. It is ionized and it is diffusible through capillary membrane. This is the biologically active form of the calcium and crucial for nerve conduction, muscle contraction, heart function, and bone mineralization. In the plasma, inorganic phosphate exists in two forms. One is monohydrogen phosphate, monohydrogen phosphate, and another is dihydrogen phosphate. So these are the two forms of the plasma inorganic phosphate. The concentration of monohydrogen phosphate is 1.05 millimole per liter, while the dihydrogen phosphate is usually around 0.26 millimole per liter. Both these forms are interconvertible based on the pH of the extracellular fluid. And whenever the phosphate is increased, both are increased. And in acidic condition, that is the lowered pH, the bihydrogen or the dihydrogen phosphate H2PO4, its concentration is increased, while monohydrogen concentration is decreased. While in alkaline conditions, that is the higher pH, the H monohydrogen phosphate or HPO4, this concentration is increased and the dihydrogen phosphate is decreases. It is difficult to measure each form separately, so phosphate levels are typically reported as total inorganic phosphorus, and the normal range is in the adult is 3 to 4 gram per deciliter, and in children the normal value is 4 to 5 milligram per deciliter. Then what are the non-bone effects of altered calcium and phosphate level? Phosphate, if there is any mild to moderate change, even to 2 to 3 times of the normal, if there is a change in the phosphate, it does not cause major immediate effect on the body. Phosphate alteration tend to have long-term effect, especially on bone mineralization, cellular metabolism such as ATP generation and nucleic acid, while the calcium is more sensitive. If there is slight change in the calcium ion concentration in the extracellular fluid, it can cause dramatic and immediate physiological effect. High calcium or hypercalcemia will result in decreased neuronal excitability, muscle weakness, fatigue, or possible cardiac arrhythmia, while low calcium or hypocalcemia will result in increased neuronal excitability, tetany, muscle spasm, convulsion, can cause laryngeal spasm and death if serious. It has got also chronic effect on bone. Chronic hypocalcemia or hypophosphatemia will impair the bone mineralization and may lead to rickets and osteomalacia, rickets in children and osteomalacia in adults. Now the effects of hypocalcemia. So the hypocalcemia causes nervous system excitement and tetany. If this concentration of ionic calcium is decreased in extracellular fluid, there is increased excitability. So the neuronal membrane become more permeable to sodium, and there is early initiation and easy initiation of the action potential. When the concentration becomes half in the extracellular fluid, the peripheral nerve becomes so excitable that there is a spontaneous discharge and result in tetanic muscle contraction. The tetany ordinary occur when the blood concentration falls from its normal level of 9.4 to about 6 milligram per deciliter, which is only about 35% below the normal calcium concentration. And if even become lower, it may become lethal. So this picture is showing a tightly clenched hand with flexed wrist and extended fingers, particularly the thumb and index finger. Thumb may be tucked inside the palm, and this posture is sometimes also referred as obstetrician hand, and due to its characteristic appearance. The hypocalcemia leads to increased neuromuscular excitability, spontaneous muscle contraction, and overactivity of the peripheral nerve. And this classical picture is the classical sign of the often elicited during physical examination of the patient or observed spontaneously in severe hypocalcemia. It is one of the earliest physical signs indicating calcium imbalance and seen in conditions such as post-thyroidectomy, vitamin D deficiency, and hypoparathyroidism. So, this can result in excitable brain and development of seizure in the patient also. And at 4 milligram per deciliter calcium ion, there is a risk of death, usually due to laryngospasm or cardiac complication. In laboratory animals, some other uh, symptoms and signs and some other findings are also seen, such as marked dilatation of the heart, changes in the cellular enzyme activities, and increased membrane permeability in various cells. Also, there is impaired clotting. These are seldom seen in the patient. So, the hypocalcemia causes severe neuromuscular hyperexcitability, manifesting as tetany, seizure, and potential death. So, it is a medical emergency when severe. The hypercalcemia refers to elevated level of calcium ion in the blood. Normal is about 9.4 milligram per deciliter. And when the calcium ion level increase in the extracellular fluid significantly above normal, it begins to have depressant effect on many physiological systems. So the nervous system become depressed and there are sluggish reflex activities due to decreased neuronal membrane permeability to sodium. There is also mental sluggishness, fatigue, muscle weakness, decreased neuronal excitability, along with cardiovascular effect, that is shortened QT interval on ECG, and there are increased risk of arrhythmias. In the GIT, there is lack of appetite and also constipation due to reduced muscle tone in the GI tract. The symptoms start uh, at about 12 milligram per deciliter level of the calcium, and these symptoms are marked at 15 milligram per deciliter, and there is precipitation of calcium phosphate crystal throughout the body at 17 milligram per deciliter. So these calcium phosphate crystals may cause organ damage, and this is seen sometimes in parathyroid hormone toxicity, that is hyperparathyroidism. So the threshold for symptoms are at 12 milligram per deciliter, there is mild symptoms, while at 15 milligram per deciliter, marked CNS depression is seen, and at 17 milligram per deciliter, there is tissue calcification risk. Thank you for watching this video. If you have any query, please write in the comment box.